Welcome to Something to Talk About. Today, we're going to be talking about long-term care. And we have expert on the subject, Dana Gargus, who is the ombudsman for the Kitsap County Aging and Long-Term Care or Senior Information and Assistance. We'll get the details in a minute. But she will talk about what every elder and those who support them should know about long-term care. Your future self will thank you, as we said in our presentation earlier this year. Before we do that, I want to thank Fieldstone Communities of Bainbridge Island because as a nonprofit, we depend on sponsors and donations, and Fieldstone is one of our sponsors. They support this program. They offer independent living, assisted living, and memory care up on Rolling Bay. They also have day stay and respite care programs. To learn more, to take a tour, call 206-594-1010 and ask for Celia or Jamie. Also, we'd like to acknowledge that we are meeting on the ancestral homeland of the Suquamish people, the people of the clear salt water who have lived on the shores of the Salish Sea since time immemorial, and we are learning from them to be better stewards of these lands and waters. Thank you very much, Dana, for joining us. I appreciate you taking the time.
My pleasure.
Okay. I know that you're going to be sharing some slides, so if people are happening to listen to this, if you go to youtube.com/BI Senior Center after the fact, if you aren't here in person, then you can see the slides as well as hear what Dana has to say. So you can go ahead and try to share your screen, Dana. And we'll get started. So are you with Information and Assistance Area Agency on Aging or what?
You know, yes, it gets a little complicated. We do that. Oh, that's better. So we'll talk about that. The easiest answer is that my business card and my paycheck have the Kitsap County emblem on them. My direct boss, however, is the state long-term care ombudsman, which is a part of the Department of Commerce for Washington State. So it gets a little convoluted.
Okay.
Okay. I'm assuming that you're taking care of the admits, and I'm just going to take care of my slides and
yes, that's
get
correct.
going here. I am always receptive to audience engagement. If you've got questions, I'm not great at the multitasking of watching hands coming up or anything like that, but there's Reed, so he can interrupt me and throw out the questions as we go. And there'll be certainly time for questions at the end. So we held this symposium back in March, but I've made a couple updates to the slides today because heck knows there's been a lot of politics happening since March. So we'll get through it as much as we can. And hi there. So this is all about planning for long-term care. The idea of 101, this is your basic entry-level course into planning for long-term care, and by all means, your future self will thank you for it. So as I had said with Reed, I am a part of the Kitsap County Aging and Long-Term Care. The Aging and Long-Term Care here in Kitsap County is an area agency on aging, a AAA. My little X in the bottom of the screen, AAA is not just for the automobile club. No, especially if you're dealing with seniors. AAA is your link to all kinds of senior services. It is the area agency on aging. And their purpose is to plan and coordinate and support a variety of in-home and community-based services for elderly people and their families. There are 629 area agencies on aging across the United States. Kitsap County is within the county bounds, is its own area agency on aging. I've got my little thumbs up guy here. This is one of the great keys that I've got a couple of them hiding within the slides. For right now, today, this is a good link. I cannot make promises beyond that because I'm giving you a link here that comes from the Administration on Community Living, ACL, which is proposed to be X'd out of the future budgets coming out of Washington, D.C. But right now, eldercare.acl.gov is an awesome website. You go to this website, all you have to do is plug in a zip code and you will get a printout of all of the senior services in that location anywhere in the United States. The area agencies on aging within the state of Washington, this is a map that shows you how they're all laid out. It's based upon populations and geography. So obviously some of our more sparsely populated counties, there's a lot of them combined to make areas. The ombudsman and the ombudsman program, our regions pretty much mirror what the area agency on aging regions are. So I am the regional long-term care ombudsman for Kitsap County, just the little brown area. And I have 12 counterparts who are regional ombudsmen for their locale across the state of Washington. Within the Area Agency on Aging, there is a multitude of programs that are living under that umbrella of the Division of Aging. This is where you find information and assistance, where you can get a live person 5 days a week that can answer your phone calls if anything senior related. The phone number to reach information and assistance is at the top of the screen. There's the Caregiver Support Center. There's the Kinship Caregiver Support. The Medicaid long-term care case managers are all housed within the Division of Aging. There are senior drug and Medicare improvement programs. There's my program, the Ombudsman program, the Meals on Wheels Kitsap. The contract comes through the Division of Aging and Long-Term Care. There's mental health and alcohol and substance abuse counseling services. Again, these are all geared towards seniors. There's legal assistance. There's a dementia specialist. These are all services available to you through our AAA.
So there's somebody on the phone. So I'll write the number. You might write the number down: 360-337-5700. 360-337-5700.
This is how Kitsap County residents link to their senior services. That's the magic phone number, 360-337-5700. So most of the rest of today, we will talk only about one of those programs hiding under the umbrella, and that's the Long-Term Care Ombudsman program. This is a volunteer-based program intended to improve the quality of life for people who live in licensed long-term care facilities. And what I mean when I'm referring to the licensed long-term care facilities is the nursing homes, the assisted living facilities, the adult family homes, and the state veterans homes. In Kitsap County, we have Retzel, which is the largest veterans home in the state of Washington. So my direct phone number, if you need me, it's just 2 digits off from the main AAA phone number. The phone that rings on my desk is 337-5714. That's area code 360-337-5714. So let's get into long-term care. Most people have the goal of wanting to age in place. People on Bainbridge Island, we have our homes where, I know me personally, I've been hiding in the woods for 30 years and I don't want to leave. It's a great quality of life. None of us really think about leaving that independence. However, we are all just one fall away from needing long-term care. And that's the reality. And part of this that we're asking our future selves to think about this, are knowing that our future selves are going to really thank us for this. It's time to just sort of break out of the myth that you're going to be able to live independently in your own home forever. I jokingly tell my family they'll take me out of my house feet first, but that doesn't mean I don't need to have a plan in place in case life has a different plan for me.
Which the chances are it will.
Absolutely. So what do we mean by long-term care? Long-term care is a range of services and supports designed to meet your personal care needs. In the industry, we talk about the activities of daily living, the ADLs. And those are the basic ADLs are the bathing, dressing, toileting, transferring from your bed to a wheelchair or from a wheelchair to a commode. If you need help with your incontinence or you need assistance with eating, these primary activities of daily living. If you need assistance in 2 or more of these kinds of activities, you are going to be eligible for long-term care. There are instrumental activities of daily living, some of the lower tier necessities, but are still they're important to think about. Being able to do housework, managing money, taking medication, preparing and cleaning up after meals, shopping for groceries or clothes, using communication devices, caring for your pets, or even just responding to emergency alerts. These secondary issues certainly become much more primary as people become more deficient in their abilities to take care of their activities of daily living. And as you need assistance in all of these, that's when it's time to really think about, oh, maybe being home alone is not the safest choice. Let's see what else we can do. So now is when you plan. The idea is that you do not want to be making decisions from a hospital bed. You don't want to be in a situation where you can't be communicating with your family what your choices are. And if your family are sitting there being asked by hospital personnel what to do next, and they don't know your wishes, that's what we're trying to avoid. That's what your future self will thank you for. So my intent today is to just be opening up the world of long-term care. I'm not asking you to make decisions today, but I'm asking you to be open to be educating yourself so that you can really be thinking about this so that decisions aren't made in a time of crisis, because good decisions frequently are not made in a time of crisis. So, home health versus home help. Let's start at home before we even get into a facility. As we talked about earlier, most people want to be in their own home. Home health and home help, they're written out here because they're very different services, and it matters not to mix the names up. Home health is a Medicare benefit. It is paid for 100% through your Medicare. However, your doctor needs to prescribe it. They need to recommend you for home health. You then go and approach, I don't know if I think there's 3 different home health services that are working in Kitsap County right now. There's usually only just a few. People who are licensed through the Centers of Medicare and Medicaid to deliver home health. And if you think about home health is a professional level of care. These are visiting nurses, visiting occupational therapists, visiting physical therapists into your home. Home help is just what it says. These are caregivers who are there to help you. They'll help you get dressed. They'll help you eat. They'll help you get to the doctor. These are much more informal. Medicare does not pay for this. Some Medicaid does. Long-term care insurance sometimes does, and people pay out of pocket. And there are 12 or 20 different companies operating within Kitsap County that have home help caregivers.
And home health is, as I understand it, generally time specific.
Yes, the way it works is generally when people are in the hospital and then they might do some rehab in a nursing home, and that transition home from a nursing home back to your home, there's usually home health prescribed for about a month. A month or a month and a half is when you get these people, these professionals in your home to help you out. The assumption is that within 6 or 8 weeks, you should be strong enough to go to the physical therapy outpatient clinic, and you don't need physical therapists to come into your home any longer.
And based on my experience with my father, there's also a presumption that you need to keep improving on whatever the project is, so that if the physical therapist or the occupational therapist doesn't see improvement, can't document it, then the program will come to an end.
So we'll talk about Medicare in a few slides down, but the presumption in when Medicare is the payer in the long-term care system, they're paying for your rehabilitation with the assumption that you are getting better, you're getting stronger, you are making improvements. Once you stop making improvements, essentially Medicare is going to back out, and they're going to try to terminate the care, because the intent of Medicare is to just get you over the hump, get you into your new normal, and then they bow out. There's a pretty prominent lawsuit on the books that talk about you should still be able to have access to your Medicare if by not having those professional services, you will backslide. But that's another piece of it. So when we're talking about long-term care, we have skilled care, and skilled, like we were talking with home health, See, I'm even getting it mixed up. Skilled care are those professionals, the physical therapists, wound care, speech therapy, IV medications. That's all skilled. Whereas the bathing, the grooming, the walking, medication management, that's more long-term. And these two different subparts are going to veer off here into what we know of as nursing homes versus assisted livings. So the skilled nursing facility, nursing home, or rehab facility, all the same thing under a different label. It's just politically correct to tell you that you're in a rehab facility because nursing home has all these negative connotations to it. It is licensed as a nursing home. It is a nursing home license, all of these facilities. This is a nursing home situation.
Nice Zen activities
Yes.
going on the front yard, though, in that slide.
Yes, just because you're in a nursing home doesn't mean you're only in bed and you're only behind closed doors. So what is a nursing home or skilled nursing facility? The Department of Social and Health Services, they license the nursing homes. A nursing home, by definition, a nursing home has 24-hour-a-day nurses present. They can provide skilled care. There's therapies, there's nutrition management, In addition to the skilled care, they have activities and social services. They do laundry. There's approximately 225 skilled nursing facilities in Washington state, and most of them are privately owned for-profit businesses. In Kitsap County, we have 9 skilled nursing facilities. 2 of our 9 are actually nonprofits. Martha and Mary up in Paulsbo is owned by the Lutherans and is a nonprofit. And then we have Retzel, our veterans home down in Port Orchard. It is the largest veterans home in the state. There's about 260 beds at Retzel. The other ones, these are all names that most folks are familiar with. Northwoods Lodge. On Bainbridge Island, we'd have Bainbridge Island Health and Rehab. That's the only nursing home on Bainbridge Island. There's several in Bremerton. There's Bremerton Health and Rehab, which has its name is currently Bridgeview Care. Its name is about to change. They're just changing owners again. We have Emerald Bay, which used to be Forest Ridge in Bremerton. We have Stafford at Belmont, or Belmont Terrace is how they're being called now. We have Life Care. We have Avamere at Ridgemont in Port Orchard. There's 9 of them across Kitsap County. When people have more of a need for that less skilled, more assisted care with just activities of daily living, then you can look towards care in a more residential setting. We have assisted livings. They used to be called boarding homes. That's also synonymous. The boarding home licenses are now all referred to as assisted living licensed facilities. And then we have adult family homes. We'll talk about the difference between the 2 of these. Both assisted livings and boarding home, adult family homes. These are, for the most part, these are private businesses, and they can choose the degree of care they're gonna provide. So this is not one size fits all kind of shopping when it's assisted living or adult family homes. Every home is unique, and the law says that the family home or the assisted living, they must disclose right up front what they will and they will not provide. And then the buyers, the public, now have information on how to choose and make good choices for their loved ones on where to go. So in essence, it's sort of a bad example because they're all owned by the same company. But in essence, the services that are provided at the Mark don't have to be the same services that are provided at Wyatt House. Bainbridge Senior Living can choose what services they want to provide at which place. Some adult family homes cater towards the developmentally disabled. Some adult family homes cater more towards those with dementia. It's their professional choices, business owners, to figure what they want to, what population they want to cater to. They just need to disclose it. So
yeah, at the top of this, I talked about Fieldstone as a sponsor, but I mentioned they have 3 different tiers. And so depending on sort of what part of the organization you were to check into or move into, the support might be different, and certainly the pricing would be different.
Yes. So if you and I, Reed, walked into Fieldstone, there would be the 3 different tiers would be independent. You wouldn't get any of this. And independent is the assumption this is a senior apartment, and you're going to have the extra added goodies of getting some meals provided, some light housekeeping, some laundry. You're going to pay a pretty penny for it, but you've got this nice apartment. You're an independent. And so you're not going to get any disclosures of services. None of these things really apply. Those are independent people. If you need assistance in your activities of daily living, if they're going to provide any levels of care, then all of a sudden the law says they must give you a disclosure of services. You might need their regular assisted living. You might need memory care. I'm not sure what, it's a good question. I'm not sure whether they're going to give you a one disclosure of services that will sort of cover all of it, because the Fieldstone at Rolling Bay has one license. They have 3 levels of care, but they're really one building, one license. And so they really are only required to have one disclosure of services. But
if you're looking at one of these facilities or settings, then you want to make sure you understand
what they
is
can
in that.
do and what they can't do. And, you know, maybe you are a celiac. Can they provide you a gluten-free diet? Some places can, some places can't. Can they provide you a kosher diet? Can they provide you a mechanical mushed food diet? Two-person transfers are frequently what trip people up. If they disclose in their disclosure of services that they will provide one-person transfers, they will not provide two-person transfers. So a good example of this is Bay Vista Commons, which is an assisted living in Bremerton. Their disclosure of services says one-person transfers only. They don't have the staffing for 2 people to be taken off the floor to make a 2-person assist with transfers, getting somebody out of bed into a wheelchair or onto a commode. So there was a resident there who fell and broke her knee. And she was taken from the hospital after she had gone through surgery and repair of her knee. She was shipped back over to Bay Vista Commons. And Bay Vista Commons had to meet her at the door and say, no, you can't come back. You are a 2-person transfer with that broken knee, and we can't take care of that here. And as long as they've disclosed that it is within their rights and responsibilities to make sure that they're not bringing people in their facility that they can't meet their needs. So if you've got a debilitating situation where you think you might in the future need a 2-person transfer, check it out up front. Will the care needs available to you at that facility, will they be able to accommodate you as time goes on? Because for the most of us, care needs increase over time.
Dana, what two-person transfer? What does that mean?
That means it literally takes 2 people to help get you out of bed, get you onto the toilet. If you are immobile and if you are larger sized, you might need a mechanical lift, a Hoyer lift, literally a sling that will help pick you up out of bed and lift you up and put you onto a wheelchair. By law, that for safety reasons, 2 people have to operate that procedure. And that means that's an extra caregiver off the floor in your room helping you move that can't be taking care of other people. So a facility has to staff extra people if they know that some of their residents are 2-person transfers. And that's where they're potentially losing money and they draw the line and they don't want to do that. It's most common for assisted livings and adult family homes to ask for 1-person transfer only. So Kitsap County has 23 assisted living facilities. There's a number of them on Bainbridge. We're talking about Fieldstone, and then in addition to Fieldstone, we have the 3 different facilities that are owned by Bainbridge Senior Living. We've got several facilities in Paulsbo. we have facilities through the rest of the county. Originally, when I made this slide, I was trying to differentiate what was licensed as assisted, which ones had some memory care there, which ones were freestanding memory care. And I was trying to do my little colors and stars and trying to differentiate. Right now, today, dementia care, if somebody needs a secure memory care facility, it most likely is licensed as an assisted living facility. Some assisted living facilities incorporate memory care under the same roof. So we talked about Fieldstone. They literally have independent apartments, assisted apartments, and then they have a whole wing of the building that's memory care. Usually in memory care, there's a combination security door so people cannot have access to leave the building independently. These are people who are not safe to do that. Some facilities have a freestanding memory care. I'm thinking, looking at my little map here, Ridgetop. So the people who own Northwoods Lodge, Encore Communities, have the nursing home Northwoods Lodge. Right next to them is an assisted living on the same campus, which is the Clearbrook Inn. And then up the hill a little bit up on Ridgetop is the Ridge Secure Memory Care. It's a freestanding licensed memory care facility. And the reason I'm spending so much time talking about this, well, we'll talk quickly, we'll catch up here. So we have the assisted livings. There's more than 500 of them in the state of Washington. They do allow people to have more of an independent lifestyle. There are people who are in assisted living who still have their own car. Maybe they need some help with remembering about their medications. Maybe they need some help with their meals, and maybe they need some help getting dressed. But once they're dressed, once they're in their wheelchair and they're all medicated, they're out of there for the day, and they're buzzing down into TNC or going to the library. They're out and about, or maybe they're in their car going and doing things. Normally, assisted living facilities have 7 beds up to about 150 beds. This is what I wanted this is one of my new extra slides, which I thought the graphics sort of explain it all. You have the assisted living on the right side, where you've got somebody who needs some assistance, but they pretty much, they're aware of where they are. They're aware of what they need. They can ask for what they need. They can receive help. And then you have the left side, where this is memory care. And maybe they don't know where they are, and maybe they don't know exactly who you are and that you're there to help them. They might not know what it is they need, and they might not understand the help that they need, and they need extra care because of the advancement of their dementia. So at the end of April, Senate Bill 5337 passed. It was signed by the governor. And that means that starting in July of next year, memory care facilities are going to have to be licensed separately as memory care facilities. And they will no longer be assisted living facilities. They will be memory care. There will be a requirement of extra education for those staff members who are working in memory care. It's finally, our state is acknowledging the extra vulnerability of that population that lives in our memory care facilities. All righty. Next, adult family homes. There's 56 of them in Kitsap County. My map is a little bit clustered there, but please, as I've been showing you these maps of the county, one of these points that I really am trying to hit home is there's nothing in the northern part of our county. There's very little offered on Bainbridge Island. There is nothing north of Paulsbo. Nothing. If you are in Kingston, if you are in Hansville, you are traveling south to get long-term care. If you are on Bainbridge Island, it's very, very likely you are leaving Bainbridge Island to receive long-term care. So an adult family home is literally a home. There's over 2,500 adult family homes in Washington state. These are, for the most part, these little independent businesses. They are houses in neighborhoods. You frequently recognize them because they just happen to have a handicapped ramp in front of the house. Most of them can't have more than 6 bedrooms, 6 people living in the adult family home. So the law says that you can care for one unrelated person in your home and charge them money. And as soon as you bring in the second one, you have to be licensed as an adult family home. So these are going to be 2 to 6 residents in a home, in a neighborhood, receiving care. Frequently, you'll have one caregiver in the home and 6 people living in the home. The caregiver might work a 24-hour shift or might work a 12-hour shift, and then somebody else comes in. The caregivers will trade off. The people all stay there. So that one person is going to be cooking and cleaning and toileting and bathing and doing all the care for the 6 people who live there. The reason why I am here and the reason why I get involved in all of this stuff comes back to the 1987 OBRA, the Omnibus Reconciliation Act, signed by Ronald Reagan. It started the Nursing Home Reform Act. It was the first time that we literally got nursing home residents' rights laws in place. And it became federal law that residents had the right to be treated with dignity and respect. They have the right to be informed, and they have the right to consent to what's being done for them. They have a right to refuse care. They have a right to the freedom from abuse and neglect, freedom from physical and chemical restraints. What's awesome about this Nursing Home Reform Act, nowhere that I am familiar with in American society is there literally federal law that says people have a right to be treated with dignity and respect. It is part of federal law that if you're living in licensed long-term care, or in a nursing home rather, you must be treated with dignity and respect. My there was this. Federal law covers nursing homes. Our nursing homes are partially paid for through the Centers of Medicare and Medicaid, CMS. There are federal dollar nursing homes, and they fall under federal law. Assisted livings and adult family homes receive monies. They are not under federal law. Back in 1994, the state of Washington was the first state in the union that recognized these nursing home federal laws need to be enlarged, and they need to be expanded so that they can cover assisted livings and adult family homes and the veterans home. And so in Washington state in 1994, those laws were expanded, and those laws cover everybody in licensed long-term care. This is not the case in every single state. So what you know in a nursing home in Washington state should be absolutely identical to a nursing home in Wyoming or in Florida, but assisted livings, not so much. You're going to have to learn it by state by state. And how do you do that? You go back to that eldercare.acl.gov and you look up your zip code and you find out where your ombudsman is or your senior information and assistance, and you contact that local office and they can fill you in. So the residents' rights laws are pretty darn cool. And whenever I give a lecture about residents' rights, I talk about sex, chocolate cake, and smoking, and making sure that people know that when you live in licensed long-term care, you are not a prisoner, you are not a child, and you are not allowed, the law says you have to be treated with dignity and respect. If you have the capacity to understand about sexual intimacy, to want to engage in sexual intimacy, even if it's with somebody who is not your spouse or might be somebody else's spouse, if you have two consenting adults get to be able to behave in consenting ways, and they have to be left alone. When you've got a diabetic, a brittle diabetic, if everybody's being served chocolate cake to celebrate somebody's birthday, that brittle diabetic might be offered alternatives to sugar-free cookies or sugar-free ice cream, a reminder of what that chocolate cake is going to do to them. But if they choose to eat chocolate cake, they have a right to eat chocolate cake. The facility needs to understand that they're eating that chocolate cake. The nursing staff needs to be aware. They probably need to get the insulin ready. They have got medical things to do because they have the legal requirement to manage the care of the people who are within their facility. But they don't have a right to forbid somebody from eating chocolate cake. Just because people live in long-term care doesn't mean they've lost the right to make bad choices for themselves. I can stay in my house and kill myself with chocolate cake if I want to. The police are not going to come in and get me. We all have a right to make bad choices in our own homes. People who live in licensed long-term care, those are their homes. They have a right to do what they want to in their home, within reason. The smoking as well, people have a right to smoke. Some facilities are non-smoking campuses. That has to be respected, and that means they will have to go off campus in order to smoke. Some long-term care facilities have designated smoking areas, and they do allow smoking. There is one nursing home in Kitsap County that acknowledges and allows smoking on the campus, and that's Emerald Bay, which was formerly Forest Ridge in Bremerton. However, because Emerald Bay is a nursing home and falls under federal regulation, marijuana is illegal. Assisted livings, so down the block from Emerald Bay is the Arbor Assisted Living. They're literally maybe a mile away, but they're assisted living. They're under state regulation, and marijuana smoking is legal in the state of Washington. People at the Arbor Assisted Living, they're smoking cigarettes or marijuana within their smoking shelter. It's a smoking facility. They're allowed to smoke in their smoking shelter, and they're allowed to smoke whatever they want to smoke. All right, let's move on. So there are 2,963 licensed long-term care beds in Kitsap County. In 2024, 22 certified volunteer ombudsmen provided over 2,600 hours of resident advocacy and representation. What my office does with my team of volunteers, is we are in all of these facilities advocating for the rights of all the residents who live within these facilities. Every licensed long-term care facility in the state of Washington must have the yellow poster posted on the wall in a very obvious location. Frequently, you will see multiple copies of the yellow poster. Notice, if you're concerned about abuse or neglect or violation of rights, the first phone number on the yellow poster is who you call if you have a concern. The bottom phone number on the yellow poster is that phone that rings on my desk. So this is how you can make reports to the branch of DSHS that's literally licensing in these facilities. These are the people that literally have the power to shut the doors, close the facility down in worst case scenarios, or at least tell the facility, clean up your act. You're not allowed to bring anybody else in until you show us you know how to take care of the folks you already have there.
And I'm guessing that having your team of volunteers and yourself in the field helps develop those relationships so it often doesn't ever get to that point.
Absolutely. I frequently sit down with administrators in facilities and let them know my viewpoint of my program is that my goal is to make each facility the best it can be, reminding them of what the regulations are, what the residents' rights are. And yes, if I can see that there's a residents' rights violation, let's fix it right now before the state is ever involved. Because I'm not the police. I don't want. Kitsap County is too small and we have too few facilities. We can't afford to have any of these closed. We collectively, we need these facilities to be the best they can be. So finding a facility. This is a really important website. And instead of having you write down all of the little details on how to get to this website and not being able to push the little buttons to link in, I have a little bit of a internet primer here. So, forgive me, I hard push here. First, you go to dshs.wa.gov. This is the DSHS website for the state of Washington. Across the top of the screen, there are multiple different colored tabs. You want to choose the adults, the amber colored adults tab. When you push the tab, the third item down on the pop-up menu, can you help me find long-term care in Washington State? So I'll go quickly back here. Any questions about that? You're going to get a search engine. You can choose adult family homes. You can look at nursing homes. You can look at assisted livings. You can look at them by zip code. You can look at them by the names of the cities they're in. You can play around with the list, but every single licensed long-term care facility is on this DSHS list.
dshs.wa.gov.
Correct. Adults tab, third item down on the pop-up menu. So the next step is, how in the heck do you pay for long-term care? We've talked a bit about Medicare. Medicare pays for a small sliver of this. WACARES, which is not on the table yet, but is coming. But usually if folks are seniors now, they haven't paid into the WACARES system. And for those who don't understand, WACARES is the statewide long-term care insurance policy that the voters of Washington State put in place several years ago. And it's not going to start paying out benefits until next year, but only to those who've been able to be working in Washington State and paying into it. So those who have already retired missed that window. Veterans benefits do pay for some of this. Some folks have long-term care insurance, those who have paid, and I know if you've had a long-term care insurance policy for a long period of time, you have paid dearly to have it. And it's always wonderful when I meet those families where the gamble has paid off, that it has been worth it, all of the hardship of making those payments every month. Because the long-term care system, this is expensive. You will learn that private funds can get, private nest eggs can get just decimated very quickly. On average, expect a nursing home to cost around $12,000 a month. An assisted living is probably going to cost somewhere between $9,000 to $10,000 a month. If it's memory care, I've heard of memory care going up to $14,000 a month. The more care you need, the higher the price. Adult family homes traditionally cost less, but not incredibly less. And so frequently the way this system works is that people exhaust their private pools of money and ultimately end up on Medicaid, which is medical welfare. Medicare pays for skilled care after you've had a qualifying stay in a hospital. Nursing homes only. Remember, skilled care is delivered in a nursing home. Medicare does not ever pay for assisted livings or adult family homes. Medicaid is a state and federally funded program, and it does pay for the long-term care. It's income-based, and it is the payer of last resort. For nursing homes, this is just a cool little pie chart from 2023. 45% of nursing home money was coming from the Medicare system. Most nursing home stays are that short-term Medicare stay. We will talk a little bit. Yes, okay. So Medicare pays for short-term rehab skilled care. It does not pay for long-term care. So you need to understand those differences. The short-term Medicare stay is in a Medicare certified skilled nursing facility. These are temporary stays that come after a qualifying hospitalization. 3 midnights in a hospital, then you can get discharged to the nursing home, and you can get rehab in the nursing home. Under original Medicare, day 1 through 20 in a nursing home is paid for 100% through Medicare. Day 21 through 100 is all paid for except for a $200 per day copay that you have to pay to be in the nursing home. And there is absolutely no Medicare benefit beyond 100 days. On day 101, you pay 100% of the cost.
This is the point where I remind you that we have about 15 minutes.
Yikes. Okay. So let's do Medicaid. Medicaid is technically for the aged, the blind, and the disabled. In Washington State, you might hear it called Apple Health. In California, they call it Medi-Cal. In Washington, we call it Apple Health, but it's Medicaid. The big deal here is because this is welfare, this is a means-tested program, you are going to be asked about your finances for 5 years prior to the date you apply. There is a 5-year look back. What happened to all the money? Was the money spent for your care, or did you pay for the grandkids' college education or buy somebody a car? If you gifted away your money, you will not be eligible for Medicaid. There will be penalties. Your money is for your care. Long-term care Medicaid can pay for a nursing home. It can also pay for Community First Choice, which provides over 50,000 people to be getting caregivers coming into their own home or by living in assisted livings or adult family homes and having Medicaid help pay for that. There's a few other Medicaid programs that can help: the Medicaid Alternative Care, the MAC program, which has services and supports to help unpaid caregivers, or the TSOA program for care receivers whose finances are a little too high to qualify for Medicaid. If you receive Medicaid to cover your long-term care, there is going to be estate recovery, which means if you own real estate in the state of Washington, the state of Washington will potentially lien that real estate for the amount of money that they spend on your care through Medicaid and ask that you pay back upon your death. This is important. This is, again, one of my new slides. As of Friday, Senator Cantwell had issued a press release. The proposed Medicaid cuts, all this conversation, statewide data shows that in the state of Washington, 105,700 Washingtonians are receiving home-based long-term care services. In Kitsap County, that's 1,754 people receive Medicaid to help them stay at home with long-term care services. 94% of the people that were polled said, the caregivers that were polled said that their clients would likely need to be care at the ER if their home care stopped because Medicaid was cut. 94% of the people who were polled said that. Think about all the problems that we have at St. Michael's ER now. Also, know that in Washington nursing homes, 52.3% of their revenue comes from Medicaid. Our nursing homes are potentially looking at a cut to over half of their income if the Medicaid cuts go through. Of the 68 nursing homes that were polled in this recent study in Washington state, 65% of them said they would consider closing if they lost that kind of revenue. This is a big deal. We all rely on Medicaid as being our safety net, and it's going to have huge impacts. I'm sorry, I don't know, how am I doing on time here? Quickly, so the Veterans Administration, know that there is a Washington State Department of Veterans Affairs, and there's a federal U.S. Department of Veterans Affairs, 2 different VAs. Retzel Soldiers Home. If you are a veteran in the federal VA system with a service-connected disability, if you have a service-connected disability of at least 70%, you can go to Retzel for free. If you are a veteran who served during a period of active wartime, and the dates are on the slide here, it's specific about these declared times of war. If you served during wartime at least 1 day, and that is not necessarily boots on the ground, you could have been pushing papers in Maryland. As long as it was in those date periods, you may be eligible for Veterans Aid and Attendance, which is a pool of money to help support you paying for long-term care. This is Matt Schillingberg. Is part of the Kitsap County Veterans Advisory Board. This is a good name and phone number to have, maybe trying to communicate with him if you need some help applying for Veterans Aid and Attendance or have some questions about veterans assistance. I'm going to skip the Walk Cares because most people in your audience are not going to really be using the Walk Cares fund.
And we have another podcast about that.
There you go. So remember, preparation can give peace of mind, and it's better to be ready and not need it than to need it and not be ready.
Thank you very much. If you have a question, we can quickly take it. And obviously, there's a slide up there about what ombudsman folks can do for you. If you're on the phone, it's *6 to unmute. In any event, I want to thank you very much. Anything you want to add?
No, my last slide here, be brave enough to start a conversation that matters. Talk to your loved ones, let them know what you want.
Yes, there are, and even if you're even if you're like Dana and what you want is to be carried out feet first, at least they know that. It may not work out that way, but that may be the long-term vision is
There
if
you
we can
go.
get you home, if there are supports to make it happen. And obviously there's a lot of recognition by Medicare and Medicaid and generally that the more we can help people without moving them into other facilities, the less expensive it will be for the culture, for all of us. But that doesn't work for everybody, as we've been talking about.
Right.
So Gargus, DGARGUS at kitsap.gov. Dana, thank you very much. And
You're very welcome.
and we will we'll put this up on the website and you can share it with folks as you see fit. I appreciate your time and I appreciate you coming both in March and again today. It was very, very helpful.
Well, I'm glad to be here. Thank you.